Hi, welcome back. And now we have this masterclass number 8, the lesson number 8. We are almost in the end. I think now we had a very good path, a very good understanding of all the techniques. But now, as you have seen from the last part of the presentation, from the masterclass number 7, now we are thinking and talking about the mucogingival as well. So let's go back a little bit and talk about the mucogingival. And what we know today is a very little talk about what I think of soft tissue today. And we should understand nicely the biotype and phenotype. You know, it's the same thing. They are synonymous, but in the last classification, as a definition, now we should talk about phenotype and not biotype. But when you read the old papers, they always talk about biotype. So this word you cannot really cancel. You can say you don't want to use, but when you go and you look for the keywords to find the papers, we want to talk about phenotype, or you have to see the biotype as well. We designed a study that we published last year in 2020 on the International Journal Periodontal Restorative Dentistry. It is the influence of the gingival phenotype on the outcome of coronally advanced flap. So we decided to do only coronally advanced flap. In patients, of course, we received the ethical board approval. We did the coronally advanced flap and to treat gingival recession. But we evaluated the phenotype of the patient. And we noticed that in case of thin phenotype, we had 25% of complete root coverage. In case of medium phenotype, we had 60% of complete root coverage. And in case of thick and very thick, we had 80% or more. It may, all the technique we have seen so far were focused to regenerate the deep part, or when we did the coronally advanced flap, we did only coronally advanced flap with the aim to regenerate the intrabony part, but there was no any additional work for the soft tissue. Can we do some additional work on the soft tissue? This is a question that we will answer to the last next lecture. Thank you. Goodbye.